Hello, my name is Nurse-Raji Blessing Aigbe. I am a health coach and a registered nurse. This video is for me to disagree with the saying. Oftentimes, I have heard my client respond to me saying that, oh, my doctor said that my blood pressure is okay because I am elderly. And also, my nurse said that the blood pressure is okay because I am elderly. At the hospital, I was told that my blood pressure is okay because I am elderly. This is a no-no. I'm not saying that hypertension does not come up as a result of being aged. What I am saying in essence is that patients should not be encouraged that because they are elderly, they can live with hypertension of 145/90 or 140/90 or even 140/70 or 150 something over 90. The more you have either the systolic or diastolic higher, it is high blood pressure. And mind you, there are still elderly people that live with controlled blood pressure. So why won't you fall under the people that have controlled blood pressure versus people that do not have controlled blood pressure? I am here to debunk or to say that being an elderly does not give you the go-ahead to live with hypertension. And once you've started high blood pressure with 140/70 and you feel like it is okay, believe me honestly, it will continue to increase till the point whereby you can no longer correct it. So instead of you believing that, oh, because I am elderly, I can live with hypertension of 140 or 145/90 or even 130/100, my dear, that is not correct. And I'm also sure that it is not scientifically correct. Maybe the doctor is trying to encourage you that, oh, you are better, right? You are better because of your age. But that should not give you the verdict to say you can live with hypertension. This is what you can do. Number one, you can adopt a healthy lifestyle. A healthy lifestyle has been seen to help people improve their blood pressure. Healthy lifestyle like exercise, like eating your fruits and vegetables, like drinking enough water has helped a lot of people, right, to maintain a healthy blood pressure. I'm speaking as an experienced health coach who has coached a lot of people, right, on this disease condition. Let me tell you, an individual, each person has its individualized plan, right? Your own is not the same as mine, though we can have the generalized. So in case you need help on how to manage your blood pressure for either a young person or an elderly person, please do not hesitate to seek for help or book an appointment with a health coach. The reason why you need a health coach is not because a health coach supersedes the doctor, but a health coach will be able to give you a close marking and tell you things you need that when you are away from your doctor, you can still have access to health education tips. I am not saying age does not have effect on high blood pressure. I am only saying that do not make it as an opportunity to live with hypertension and not control it. Thank you. I hope I'm not offending anybody.